Patients with diabetes are much more likely to develop serious foot problems. Diabetes-related nerve damage and decreased blood flow may allow small injuries to develop into bigger problems. Now, there are some things you can do to decrease your risk, such as checking your feet every day and getting a yearly foot exam in a doctor's office. Hey, Mr. Marlowe, it's great to see you.
Hi.
I see the nurses asked you to take your shoes and socks off for your annual foot exam. Have you had any trouble since the last time I saw you?
Not at all. They've been great.
Fantastic. So I'm going to go ahead and take a look at your feet, and what I'm about to do now, I want you to do at home every day.
I'll do that.
I'm going to focus on looking for calluses, blisters, sores, redness or swelling. Looking at areas of high risk, so looking between the toes here for dryness and cracks. Looking also at the toenails themselves, making sure that they're clipped back well and that there's no signs of any ingrowth here. And now looking underneath at where the foot actually strikes the ground, at the heel, at the ball of the foot. Again, I'm not seeing any corns or calluses, anything of concern. Checking your circulation here, and actually you have a very, very good pulse, which is equal on both sides. Obviously, it's going to be hard for you to kind of get under there, so I have a little trick for you here. I have a mirror. You may have one of these at home, I assume, right? So take a look. See if you can get under there and
Okay, this works.
right? Okay.
Sure.
And on the other side. Okay, now take the mirror, and then you want to check quickly between, or carefully, I should say, between each toe. If you do note any trouble, I need you to call me right away, because staying one step ahead of these problems is critical to keep your feet healthy. The next step here is to look at the nerves and make sure that they're working well. And in order to do that, we do what's called the monofilament test. So I actually have a monofilament here, and we're going to clean it with an alcohol swab. This isn't going to hurt at all, but it will tell us the condition of the nerves. So tell me if you can feel this at every point here where I touch you.
Okay. Yes. Yes. Yep. Yes.
And importantly, do you feel it the same on both sides?
Yes, that's equal.
All feels the same. Fantastic. So that's a test of your nerves. And if you had trouble feeling that monofilament, I'd refer you over to a foot doctor. That would be a sign that your nerves were impaired or damaged. So you want to get in the habit of doing this every day.
I'll do that every morning after my shower.
Perfect. Don't walk outside barefoot. Choose well-fitting footwear to avoid getting blisters. Avoid slip-ons, high heels, or open shoes. Use a moisturizing cream to keep your skin soft. Wear clean, dry cotton socks. These absorb moisture. And avoid nylon. Trim your toenails carefully. If you have poor vision and can't see your feet clearly, have someone trim your nails. Don't file or use scissors on calluses or corns. After washing your feet, gently rub corns and calluses with a pumice stone to reduce buildup. Have a foot doctor care for these. Make checking your feet a daily habit. It's an easy way for you to keep your diabetes in check. I'm Dr. Duran Schneider, and this has been another tip to help you live a healthier life.